the real issue that we're not able to work on, but it would be good to be able to work on it, would be the ability to offload in some ways. That if you've got a column that's mobile and it's a certain length and you compromise, say, 70-75% of it, then those discs down below pay an extra load. And in normal humanoids, the lower lumbosacral disc, the disc, and you'll hear people, your friends, etc., will come back and say, well, he said it's an L5 S1 or L4 disc down at the bottom there. And that's when you have the flexibility of the rest of the spine. So imagine that where you've got this long pole that's loading into the lower spine there. And having said that, I just had, and this is the genetics of it, a father who operated on in about 1985, 86, who's a urologist out in Kentucky. His daughter and his son came in. His was severe enough that we had to do it. And he was a boy state that when years ago they used to have, what did they call him? It was like the Mr. Football and Mr. Basketball and Mr. Swim, who were the state champions. And he won the state championship in swimming with what's called a T4 to L4 that I fused from the upper thoracic.
That's a long.
And I saw those videos of him doing, flip turns at the end, and it just didn't make
sense.
Anyway, but he went on. He was really good. He was one of these swimmers that back in the day. He was with the Marlins, and the family moved. The dad became a hospital administrator in Houston, and he actually stayed, I think, the 11th and 12th grade because of the Marlins. They were, that was an Olympic feat. And so he got a scholarship to Texas, which is one of the top swimming schools in the country. And in addition to that, he had a brain. And he went to medical school, and he went into urology, and he's a urologist out just east of Ohio in northern Kentucky.
And you showed me pictures of a girl that you had done a surgery, and she's a ballet dancer.
Oh, yeah. That was, you're bringing back too many good things here. No, I had a little girl from Louisville who was about 3.5 or 4, and she had this slippage. It's called a spondylolisthesis of her lower spine.
I have some of that myself.
She had a slippage there. I'll tell you a story about that. She had a slippage.
What degree?
And she had been, she was completely off. And she'd been told that, by the family she was going to be a back cripple, but not to have surgery because it could injure her nerves and she wouldn't be able to walk and so forth. But anyway, she came and we thought she was an adequate candidate. We did CTs on her. We didn't have MR at that time. And found that we could stabilize it and she'd be stable. And so I did, I think, a 4 to 1 or something like that, or 4 to S1. And so, I followed her for 5 years, but she was from Kentucky and she got sort of lost. And she came back to see me when she was 21. And I said, well, I'm so happy to see you. And I said, well, how's your back? And so then she proceeded, and to see the picture, it's unbelievable. She proceeded to bend her head between her legs the other way. And I'm saying, well, boy, that's interesting. I don't know what you do. And you have to do that. And then she did some other things for me. I said, well, your back is sure it's in pretty good shape. And then they brought out these pictures, and she was a principal ballerina for the Miami. And she showed me these pictures, one of her solo and with a partner dancing. So she's a ballerina, and I just said, wow, that's just great. Do you mind if I showed you? She said, no, go right ahead. And she and Mom, and it was a good day. It was a good day. There's something, the human frame is only designed to do what the human frame is designed to do, and sometimes we challenge it. Such things as gymnastics. Gymnastics and dancing particularly challenge the lower spine. And there's a condition that is an occupational hazard of gymnastics particularly, and it's called spondylolysis and spondylolisthesis, because what you're doing
Is that
is
from the
that you're...
extreme extensions?
Well, I tell the kids this. It's very comparable to you have a gym clip. And so I say, well, now, you got a gym clip while you're out there waiting. Well, what are you going to do? She said, well, it takes so long to see you. And so they'll start to straighten it out. I say, well, what happened? Well, it fatigues. And that's the same thing about lower repetitive loading in the mechanics. And it cracks the spine. And a crack is called a spondylolysis. But when one continues in that, then it can go on to what's called spondylolisthesis, where it actually drifts down. And that is an occupational hazard for dancers, not dancers, but particularly for gymnastics. As a matter of fact, I went through two iterations. One was Olga's disease, when it was Olga Corbett who had it. And that was in the 70s. And then there was Nadia's disease. And that was, the Americans now, I mean, they're far away in advance. But at that time, it was the Eastern Europeans or Russians. And it was Olga Corbett and Nadia Comaneci. And that's when they were just the gymnastics schools, and all the suburban communities in the States were just blossoming. But we saw lots and lots of kids with spondylolysis and spondylolisthesis. And then, you have just in other athletics, there's always a kid in your class that, you play intramural basketball or something, and their back would go out, and they'd be out for 2 or 3 weeks or whatever and come back. And a lot of those kids have spondies, and they don't all need to be operated. But I think the joints are only designed for so many repetitions, and when you go past that,
push them a little too hard. And as dancers, we do that to a fault.
Yeah.
Too much.
But you know what? It can work, and it works, and it really works well. So it's not that I would say that that's not a good thing to do. I think you should do the thing that you enjoy, but there are certain limitations, the things that the human
Well, and we've
frame
learned
can do.
in more recent years that as dancers, we should also work on our strength, not just our flexibility. Of course, we
Yes.
always want it to be strong, but especially the core.
See, core is a new term. You've heard core in the last 10 years, but I used to tell my patients, the most important aspect of your back is your front. You can strengthen those muscles to compensate for it. Then your back's going to be good to you for a long time. That is for the flexible nerve. Then the mechanical, the loading, anti-gravity, that's another thing altogether. Yeah.
But you're also doing work with clubfoot surgeries
Yeah.
as well.
Yeah.
India? Where else are you going?
Oh boy, the mission trip's very young. We did all of Asia and South America, mostly Brazil and Buenos Aires, but in Sweden, just all of those places. I've had a lot of fellows. I think I've had 54 fellows that have gone pretty much everywhere, and they'll invite me to come over and do some things. We were doing what's called, as a matter of fact, there's the Cincinnati incision, which is a circumferential incision that we published. And most people who are going to have open surgery now will have it through the Cincinnati incision. That's pretty much anywhere in the world they're going to have it. I talked to you about Ponseti. Ponseti has a technique that is almost like percutaneous, which is different from the open surgery. So we don't have to do as much as the open surgeries anymore. But
Is that a soft tissue condition?
Well, people don't realize the disease of the soft tissue can affect the hard tissue. Yeah, in terms of without the stretch. This is why in your business, make sure that everybody stretches and has good mobility and so forth. Because the restraint, scarring, and fibrosis of the soft tissue can cause bony changes. But it is the Achilles tendon, that is the heel cord, and the tendons about the ankle. They're pulling the foot up into this. They call it equinus, like a horse's foot. And if you can release that and bring it up, then it can work pretty well. And so there is the Poncetti, which has been done since the 50s. But he must have been about 80 when the internet came around. And through the internet, it became worldwide, the Poncetti. Ponsetti's been doing that a long time ago. If there had been the internet, then we probably wouldn't have had the Cincinnati incision, because the Poncetti procedure works pretty well. And of course, as I said, he was at that one place. He was at the University of Iowa. He's from Mallorca, which is an island off Spain. And but the Cincinnati incision got lots and lots and lots of exposure. Not only that, we did lots and lots here in Cincinnati, and we have a long follow-up of those kids, and they've done pretty well. Yeah. And that became my journey. You know, spine is a tricky thing. There's the adult spine, there's low back pain and so forth and so on. And that has its limitations. But I did what's called adolescent idiopathic scoliosis. That's usually on young girls, 12 to 15-year-old girls. And what a spine surgeon knows is that on any given day when you straighten the scoliosis out, the spinal cord blood supply may not be ready to be straight if it's been crooked for years and it's been.
I remember you talking about that.
And so you can get an unbelievable radiographic result of a very crooked spine, straight as an arrow. However, nothing functions below the waist, and that's not good. Now, having said that, at the beginning, it was saying we'd have to do what's called a wake-up test when we were done to see if the patient could move, and then if they couldn't, we'd take all the instruments out. But that field has really improved now. They have what's called craniovoc potential monitoring. So they have continuous monitoring of the spinal cord, spinal canal, while you're doing the surgery and putting instruments in. So if there's an alert or problem, you're right ahead of it. You can try to reverse it or you can abort it. And so you don't have to worry about, God forbid, the worst is to leave the operating room and go to the patient post-op consultation area, and there's a mother there and there's a father there. His 14-year-old daughter, queen of the prom. She's going to be Miss whatever state. She's going to be the football queen. She's going to be everything in his eye. And you say, well, we had a little bit of difficulty, and she's at this time paralyzed. We'll have to wait and see how things. That's a conversation that no surgeon wants to have. No father ever wants to hear, and for mother, it's interesting in the consultations that you see. It takes a while to do surgery. You go through brace treatment, so you get to know a patient, you get to know a family pretty well. And on the visits, and you may edit this out, but the mother is there, and sometimes the grandmother is there. You know, there's some genetics and familiarity. We don't really know that it is the exact genetic aspect of it, but the grandmother may have had some scoliosis, the mother and all that. So they're there, and the father doesn't come. You know, you have to be a macho man until we maybe flunk the brace, and we're talking about surgery. So the dad comes on that day, and he's got to show his stuff. And the thing about it is that the dad comes, and you know, he's sitting there, and you're talking to him, and you say, well, you know, we put these rods in, and we straighten the spine up, and we do this, and you're looking at the dad, and you're following his eyes, and you say, oh, here we go. Because, you know, it's going to be, give or take 5 seconds before he's going to be on the floor passed out. So I used to have these ammonium pearls. I don't know whether you've ever heard of those. I have one that would be for the pre-op day when the dad, because they sometimes didn't make it through. No, but anyway.
I taught the head of Doctor's Hospital in Columbus, and he started out in general and surgery and so on. And then he switched to obstetrics, and he said, and when he was in the hospital for a hernia, he said, I know I'm the worst patient because I know everything that can go wrong, and I'm a man. I gave those nurses such a hard time. So I've heard that from other doctors.
it happened consistently. So I actually carried the pearls
They
around
carried
in my pockets because and you can get that, you can sort of see it. Their eyes,
You see it
sort of
coming.
gloss a little bit. You can see, it. And especially as you get into the mechanics of how the rod is going to stretch it and how it works. And there you go. Yeah, you try to make sure you're sitting as low as possible. You don't want him to have maybe, God forbid, a head injury or something as he falls. So, no, but